not heard. P drug মানে হৈছে মোৰ personal drug. Personal drug to কেনেকুৱা হয় যে suppose আজি you have been practicing for since last 10 years, okay? And within these 10 years you are very familiar with few molecules that you write and use every day. But it is not necessary যে আজি দাদাই যোনটো লিখি আছে মই সেইটো লিখি মোৰ পিটাৰ বেলেগো হ'ব পাৰে আজি কাবাৰ এতিয়া আছে সাপোজ লাম্বোসাইক্ৰাল পেইন লৈ পেলাইছে কোনবাই ডাইক্লোফেনাক গোবেৰান লিখিব পাৰে কোনবাই এচিক্লোফেনাক লিখিব পাৰে কোনবাই পেৰাচিটামল লিখিব পাৰে কোনবাই আইবুপ্ৰফেন লিখিব পাৰে কোনবাই মেনক্সিকাম লিখিব পাৰে ইটস অল পাৰ্সোনাল সো দ্যাট ইজ পি ড্ৰাগ সো পি ড্ৰাগত কি হয় preferred P both a preferred believer. I prefer because you are used to this particular molecule. Or hetu molecule to kenake ahibo with your experience, with your own experience of the effect of that drug. There may be many brands, and if you have seen that any molecule, there are few molecules which has a monopoly. The other brand say you don't have a choice. But many drugs they have got different brand names, and then you will see always why I am writing this particular brand because you have confidence. That I my Samsung phone use good like that. So this is about the P drug, and patient profile is important because here we have to consider his economic background, his educational background, what are the diseases he already have and already taking some drug, and all these are not similar. Patient A has a different profile, patient B has a different profile. So within that short period of time, you have to calculate so many things, and then you come to a pharmacological consideration. So I am choosing these drugs, and pharmacologically these drugs should be able to give him some kind of cure or relief. Then what is the pathological demand? Sometimes we have to give his immediate acute pain relief. Then you have to choose maybe an injectable route. We need something which acts very fast. And the role of the physician here is to give some kind of relief to the patient by his behavior, attitude, and the physician's role, it aids all the drugs that we have prescribed for this particular patient. Next. Now this is something very elementary. So the right patient, the right medication, the right dose, the right dosage form. Dosage form means whether it is injectable or a tablet or a syrup or a capsule or an enema, whatever. Right time, right result, right documentation. So a patient, he comes to you because he thinks you are the right doctor. Okay. Now say suppose Bishanot 1000 doctor ase, and this person has come to you because he feels that you are the right doctor for him. Now we have to give him all these rights. The patient is right, the medication that you are prescribing should be right, and dose we need to be very careful. Sometimes we under-prescribe, and sometimes we over-prescribe. And so this optimum dosing will give you the maximum benefit, and how many days the patient needs to take has to be clearly mentioned to him, and the right reason you need to justify. So last part which I have recently added, I got it somewhere, that nowadays because of all this CPA you need to document everything correctly, because if something goes wrong, your prescription is a legal document. Patient will sue you and judge believes on whatever you have written. So even if you don't have time, please try to give a prescription so that in future that will save you. And the best part is try to retain a copy of the prescription that you have prescribed. Many hospitals, they have a system of retaining a copy. Next. Okay. Coming to another topic is adverse drug reactions. Now please understand that if a drug has effect, it must have side effect. If a drug does not have any side effect, another effect will have. It is as simple as that. Many people they claim the Ayurvedic bosthu side effect noy, homeopathy side effect nai. So he effect to queries. So any drug which has got effect must have some kind of adverse effect, and here WHO have given types. Type A. A is accelerated or augmented. I'll give a simple example. Say insulin sometimes causes hypoglycemia to a patient who is getting therapeutic dose of insulin. কেতিয়াবা হঠাৎ কি হল পানজন হাইপোগ্লাইসেমিয়া হল আজি বহুত দিনৰ পৰা ইনসুলিন লৈ আছে কিন্তু সাডেনলি ইনসুলিন ইয়াৰ পিছত পেশেন্টৰ মানে hypoglycemic feelings বিলাক আহি গল. That is a very common example that I give for type A. Type A are known, they are documented, they are already written somewhere that this may happen, and this is expected but unintended, but unavoidable also. Type B is bizarre. Bizarre means যিকোনো উল্টা পুল্টা দিল পেশেন্টক কিবা এটা দিলে something very abnormal patient may come across.